It's on. Now with knees, we want to loosen up that knee. If you have any knee problems, they generally go with the hamstrings being too tight because the tightness of the hamstring pulls that knee into flexion, making the quads work harder to straighten. The forces of the two compacts that knee and creates more wear and tear in the area, right? So what we want to do there is to create more space in the knee. And first of all is stretching the hamstrings. I like this stretch. Is just a slump stretch where you fold over, stretches the entire posterior chain all the way up to the back. Once you just bend like this, you know, your body you'll feel the tension where it's worse. And as that loosens up, you'll find another spot. So the point is you want to loosen the whole thing. But pulling the toes towards you will engage the gastrocs down here and will give you a little bit more of a stretch on the bottom. So just slumping forward. And allowing that to take place as long as you're able to without getting too bored. Sometimes listen to old movies, listen to radios just to help pass the time away. Otherwise you just, you know, lose patience being there. Okay, but you want to hold it there. It's like wearing a tight pair of pants. You just want to hold it as long as you can to stretch out the fibers to create more space for that blood flow. But if the pant is really tight and you go and stretch it, that pressure from the pant is going to cut off your blood flow to your nerves. Your foot's going to go numb and fall asleep. When you're doing a yoga class, you do a stretch for 30 seconds a minute, it's no big deal. But you do this for an hour, even getting up is going to feel achy. Okay, so sometimes if that happens, I'll just roll over. It's better to do on the floor in that case. Roll over to the floor and slowly straighten yourself up. You lie here in the corpse pose, your Shavasana, right? You hold the stretch for 1 minute. Shavasana, like this doesn't seem like a big deal, but you hold that for an hour. You're gonna be laying here for a while to allow the tissue to normalize and settle down, and that becomes important. You don't want to be moving when your legs have sleep, right? So another way of doing that is going into the plow. Sometimes I'll just walk my legs underneath the dining table, keeping my hips down, focusing on the hamstrings. Okay, you walk it up farther like this. Now you're stretching your back a little bit more. But for the knee, the hamstrings are the most important, so you can keep your buttocks down and just use the table here to kind of hold the leg in place. Allow those hamstrings to slowly melt and lengthen. Again, that tightness can cut off the blood flow. Your legs are going to go numb. Don't stretch it too hard because then it'll tear, right? Conversely, it's also important to stretch out the front of the hips. So I sit on the edge of a table or some platform that's stable, and I'm going to lie down. Sometimes I'll add a couple of pillows or sit on the armrest of the Chesterfield so that my hips are lifted. Now this is going to be pretty hard. If you don't have very good core strength, lying down like this can be a little hard on the back. So add more pillows up on the spine area to support your back so that you're not arching your spine too much, right? Just pillowing up is a good way to support yourself. If sitting on the edge of a chair or your sofa and lying back is too big of a stretch for you, just lie down on the floor with a lot of pillows underneath your hips. So kind of like in this position here. Then the floor or the sofa or whatnot is going to give you some support, and it's not too aggressive. Okay? And then once you feel enough and you can't get up, you just roll off to the side. And that keeps it safe. If you're strong enough through the abdomen and you're comfortable enough, then sit on the edge of the sofa armrest or table like this. You lie on down and just passively let your legs hang and stretch out your hips. Stretch out the quads. So right now my tailbone's on the edge there. You want to keep everything above the hip socket nice and straight and stable. You don't want to arc this way because then you'll crunch your mid-back. Abdominal muscles, rib cage needs to be pulled down and keep this area nice and stable. It'll stretch out your hip flexors, your quads as well, right? Now for the hamstrings, save damaging the wall, I just kind of hang like this.
Right.
Okay, with the head supported, and just allow the muscles on the inside of the legs to stretch out. Hold this for too long, this is going to really hurt. Use your hand to slowly ease it back, a little bit at a time. And then roll off to the side, slowly straighten yourself up to Shavasana, let yourself rest again. Okay? The goal is to lengthen the tissue, create space for blood flow. That's what's going to help correct your tissue.
Cool.
The joints and stuff, right? You don't give it enough time, it's not going to heal properly. You don't pull it hard enough, nothing changes. You pull it too hard, you damage it.
Right.
So where's that Goldilocks zone, right? You're the one that's going to know. And then the more you do it, the more you experiment with it, you know how far you need to go. Now, once you loosen things, you need to recondition and teach it how to hold and stabilize yourself properly. Otherwise, you become unstable, right? So just like a hydraulic, if you compress a balloon, it lengthens and supports. So that's how you want to try and engage your muscle. One of the ways of doing it is have you lean on the bench, press that leg straight and out from behind you. Learn how to engage your glutes and your hamstrings to create that extension. And then you can do it 2 legs at a time. Make sure the abdominal muscle here is in check, because when you push out, you don't want to be arcing your back. You want to keep this nice and straight, pulling in from the abdomen, keeping your legs straight like so. Then you can do it from standing and using the hamstrings here to compress and create that straightening just as you were lying down. You don't want to then use your quads to push and engage here. You want to continue that engagement through the back. Use elastic bands, TheraBands, tensor bands, whatnot. You can tie it to the bench, push on that, turn around this way, wrap it around your leg, and push it out this way. Okay, and that'll help you engage. And then doing a lot of deep squats this way. When you do a squat, it's really important to keep your knee behind those toes. Slowly come back up. I sometimes use the wall as a reference point so that you don't lean too far forward. You want to try to create a deep squat and come back up. So if your knees are stiff, doing a deep squat's not good because it's not allowing you to bend. You end up breaking. Just go within that zone that's comfortable. Okay. And then slowly speed it up, get a little bit of cardio. The movement and the bouncing is going to help stimulate the blood flow. So you just keep doing that until you have good full range and strength and supple enough for you to move.
Cool.
And then you start doing more ballistic things like running and whatnot to help create that dynamic movement.
Okay.
It's just a gradual process. Okay?
Cool.
So I'll put that, send a link to you with that.
Okay.
And then